Hello, I'm Yusuf and I'm the Deputy Chief Pharmacist and Clinical Services Manager here at the Rotherham NHS Foundation Trust. September 25th is World Pharmacists Day. It's a day on which we can celebrate not only our history but also our shared aspirations for the future. The evolution of the role of pharmacists, originating in ancient apothecaries, to their current influences on modern advances of pharmaceutical science has been a remarkable one, paved with innovation, compassion, and the relentless pursuit of better health. Pharmacy as a profession hinges on bridging the gap between science and the compassionate care we believe our community deserves. On behalf of myself and the team, it gives me great pride to introduce this video. Our aim is to give you a behind-the-scenes glimpse into the processes that we follow and how we are able to positively impact the lives of those in our care, from the formulation of each dose to the rigorous quality checks that ensure their safety. Every step of the journey is a testament to our commitment to our patients' well-being. So as we come together to celebrate World Pharmacists Day, let us take a moment to reflect on the impact of pharmacy on our lives. Let us commend those often unsung heroes who stand tall alongside the pillars of modern healthcare, not just their past achievements, but the relentless pursuit of better tomorrows. So sit back, watch and embrace the marvel that is pharmacy. Happy World Pharmacists Day.
Hi, my name is Suhani. I am the lead cancer pharmacist here at Rotherham NHS Foundation Trust. Started in this position about 3.5 years ago, and I have been working across haematology and oncology. And for those of you that don't know, so haematology is anything to do with blood cancers or blood-related diseases, whereas oncology is anything that's a solid tumour. So my role here at Rotherham includes a variety of things. It starts when a patient comes in to see the consultant. The consultant will assess the patient and it gets discussed in the wider MDT to decide what treatments patients should be going on. Once the treatments are decided and the patient's consented for this, what happens is we have a system where all the chemotherapy gets prescribed for these patients. Once that prescription is generated by the consultant and our lovely nurses have done an assessment with the patients to make sure that they're fit and well to go ahead with treatment, that prescription then comes to myself and my team. And what we will do is we will review that prescription, we will check the bloods for the patients, make sure that the chemotherapy that's been prescribed is safe for the patients to receive, making sure that their kidneys are working okay, their liver's okay, and making sure that they haven't had any side effects that maybe we need to review the doses for. Once we think that that treatment is safe for that patient on that day, we will then authorize that prescription, and that prescription then gets printed into our aseptic unit.
As I open the door to the aseptic unit, the familiar wave of antiseptic envelopes my senses. It's the start of another busy day in the heart of Rotherham Hospital's pharmacy manufacturing unit, where the magic of medication preparation happens behind closed doors. The first task is to follow the rigorous gowning procedure to make sure that I'm as clean as I can be. This is really important because some of the medicine I'm going to make today will be used to treat some of our poorliest patients. With my gowning complete, I check the unit status. Everything's operating within the strict parameters required for our work, a critical step to ensure the controlled environment essential for sterile drug preparation. Checking the patient treatment schedule, I identify the medications that need to be delivered promptly. Our aseptic unit is not just a place of isolation, it's a hub of communication. I know that there might be phone calls from the wards or messages from pharmacists regarding urgent patient treatment. The rhythm of our work is finely tuned to the needs of our hospital's diverse patient population and their medical needs. The drug worksheet serves as the foundation for meticulous record keeping, as they must be pre-approved by the accountable pharmacist. I note down batch numbers and details of the drugs involved. This is the groundwork for collating the consumables such as needles and syringes, which will be required during drug preparation. Every detail is checked against the prescription, a crucial step in ensuring patient safety. With the worksheet in hand, I begin the 4-step disinfectant process. It's a diligent ritual involving not only the drugs themselves but also every consumable needed for their preparation. This process takes place in the inner support room, where the level of sterility is maintained at its highest. Once the preparations are complete, I transfer the materials into the isolator, a secure chamber designed to maintain a sterile environment. Then the reconstitution process begins. seconds. When the medication's ready, we can remove it from the isolator, labelled pristine and ready to treat our patients. It's passed to the outer support checking station, where an aseptic authorised pharmacist scrutinises the product for any irregularities. It's this process that helps ensure that only the highest quality medications leave the unit. With the final approval in place, we inform the ward that the treatment's ready. It's a moment of quiet satisfaction for our team, knowing that our behind-the-scenes work will soon become a lifeline for a patient in need. In our aseptic unit, we understand the gravity of our work, even if it means no direct patient contact. We're the silent guardians of patient safety, knowing that our meticulous efforts are ultimately responsible for the well-being of those we serve.
In addition to the medications that get made in the aseptic unit, we also have other medications on that prescription that supports the patients through their journey whilst having their chemotherapy. So it could be things like anti-sickness tablets. All of those medications get dispensed from our Lloyd's pharmacy here at Rotherham.